Joining us today, we are lucky enough to have with us Christine Sandor to answer your most curious queries regarding midwifery. Thank you so much, Christine, for being here.
Thanks for having me.
And without further ado,
hello, everybody. Thanks for your interest in this presentation. I am happy to spread the word about midwifery care. It's a profession within our healthcare system, but there's sometimes a lot of questions about what exactly a midwife is and what our role is and how you get a midwife and who pays for it and how do you become a midwife. So I'm always happy to share that information with everybody. So I'm going to start off by just talking a little bit about the basics about what a midwife is and where we are in the healthcare system, and what midwifery looks like in Hamilton. And then a little bit about some of the different things that midwives do, a little bit outside of the traditional things that you'd expect midwifery care to be. And then we have some questions, and we'll open it up to questions as well. So so you can flip to the next slide. So first of all, what is a midwife? When I first applied to the midwifery program, my sister was like, a midwife? Like, fetch the towels and boil the water midwife? And so, because in her head, and I think in a lot of people's heads, that traditional role of a midwife is sort of what stands out. So in a sense, that's sort of what it is, but it's a little bit different now, obviously. So midwife is a primary care provider for a pregnant person throughout the prenatal care, labor, birth, and then 6 weeks after the baby's born. So midwives provide the same lab tests, ultrasounds, schedule of visits, and routine prenatal and postpartum care that you would get if you were seeing a family doctor or an obstetrician for pregnancy. The thing that kind of defines midwifery care is that we care for people who are low risk. So this is I'm kind of just overlapping my questions here, but as long as somebody doesn't have a serious underlying medical condition or something that would put their pregnancy at a higher risk, that's who midwives provide care for. So sometimes we say we're like experts in normal, not that, and there's sometimes things are not necessarily normal, but we can still provide care for those people. But in general, that's sort of who our focus is on is the low risk pregnant population. And most people who are having babies are healthy and low risk. So most people are eligible for midwifery care. So where do midwives work? So a common question we have is if you get a midwife, do you have to have a home birth? The answer to that is no. Midwives across Ontario and across Canada work, usually their practices are outside of a hospital, like an independent practice. So in Hamilton, there's 4 independent midwifery practices. And that's where midwives would work. That's where someone would go for their prenatal visits and postpartum visits, sort of like going to a doctor's office. You have a group of family doctors who you go to their clinic for visits. Midwifery is similar in that you go to the midwifery clinic for prenatal and postpartum visits. In all the communities where midwives work, midwives have privileges to admit clients to the hospital in that community for delivery, for labor and birth. So wherever a midwifery practice is starting, they need to be able to secure hospital privileges. So that means that midwives can offer choice of birthplace. So choice of birthplace is one of the important fundamentals to midwifery care. So that means that our clients can choose where they have their baby. So in Hamilton, the options are hospital birth or home birth. There's midwives who have privileges at both hospitals that do deliveries in Hamilton. So St. Joseph's Healthcare, and McMaster. So midwives work at both of these hospitals. So in Hamilton specifically, some practices work out of both of those hospitals kind of equally, and some practices focus more on one hospital than the other, just depending on what that practice has decided. So yeah, but regardless of what community you're in, the midwives that work there would have privileges to work in the hospital. And in Ontario, I believe about 80% of midwifery births are hospital births and 20% are home births. So home birth is the another option for place of birth, choice of birthplace. There are 2 birth centers in Ontario as well, one in Toronto and one in Ottawa. And those are available to people who live in those communities whose midwives are in those catchment areas for those 2 birth centers. So those are relatively new in the healthcare system. So midwifery, this isn't really specifically one of these questions, but midwifery is funded by our healthcare. So you don't have to pay for a midwife. It's covered as long as you have health insurance. And because that's another question that a lot of people have is like, oh, midwifery care sounds great, but do you have to pay for it? But no, you don't have to pay for it in Canada, in Ontario and in Canada. Let me see, who can have a midwife? I talked about that. How do you get a midwife? So one question a lot of people have is, how do I get a midwife? Do I have to get a referral? Do I have to get my family doctor to send me a note? But it's a self-refer program. So basically, what you have to do is when you know you're pregnant, you call a midwifery practice or go online and fill out an intake form online. And as long as there's space within that midwifery practice for the time that the baby is expected to be born, then someone would be assigned to a midwife, and they would do an initial appointment, and you'd be taken into care under that midwife. So it's a self-refer program, which is great. It's quite accessible in that way. You don't have to have a referral. Many practices do book up fairly quickly, just because there's some months are busier than others, but in general, we're booking like pretty far down the road. So I feel like last week we had intakes coming in for June. So I usually say if you're thinking of getting a midwife, try to call as soon as you're looking for one, because we do book up quickly. The other thing that is kind of a foundational principle of midwifery care is continuity of care. So something that's a little bit different is one of the things that we value in midwifery care is that relationship between a client and the midwife, and having that consistency in your care provider, and also the consistency in the type of care that's provided. So different practices are set up in different ways in terms of whether midwives are working like in teams of 2 or teams of 3, and what their call schedule is like. But in general, a midwife will have kind of a group of clients that they provide care for. So you would have a fairly good relationship with either 1 or 2 midwives or 3 midwives throughout the course of prenatal care, so that when it's time to deliver the baby, the client is familiar with the midwives on the team, so that the person who's attending the birth is someone that you're familiar with and that you're comfortable with. So this is a little bit different from if you were seeing a family doctor, an obstetrician, just because even though you would have continuity of care throughout your prenatal care, meaning that you would see the same care provider throughout your prenatal visits, it wouldn't necessarily be that person who is there to deliver your baby. It would be whatever physician happens to be on call at the hospital, which may be the physician you've been seeing throughout your care, but maybe someone else who is on call at the hospital. So that's something that I think some people appreciate, is just kind of having that familiar person there to deliver their baby. And then the other part of continuity is that we provide care for 6 weeks after the baby's born. So we usually see people while they're in the hospital, and then once they get discharged home, we do home visits for the first 1 to 2 weeks, and then have people come into the clinic for until about 6 weeks. And so it's kind of nice to kind of have that, that a little bit of longer term care and consistency between seeing people prenatally and then in the postpartum period with them and their baby. So yeah, I think that's I think those are the things I want to talk about on this slide. So
Good.
how do you become a midwife? So a few things about becoming a midwife. So midwifery was legislated in Ontario in 1993. So I mean, it's almost 30 years old, but it's a relatively new profession compared to how long nursing or medicine and things like that have been around in Ontario. It used to be that midwives were educated more by apprenticeships and things like that. But when it was legislated, it was made, it's a 4-year university degree program. So it's offered at 3 universities in Ontario, McMaster being one of them, and Ryerson and Laurentian. So basically it's a 4-year program. And during that 4 years, there's about a year and a half of in-class learning. And then the rest of the 2.5 years of the program are all clinical placements at midwifery practices or at other interprofessional placements with obstetricians, nursing, lactation consultants, other kind of related fields, so that a lot of that hands-on learning is done in a clinical setting. So midwives are, once you graduate from the education program, you need to be registered with the College of Midwives. So just like there's a College of Nurses, College of Physicians, the Midwives has a College of Midwives that regulate the profession. So that means they keep a professional register of all the midwives in the province. We have to do registration each year and show them that we are up to date on all our qualifications, that we've attended a certain number of births in hospital and out of hospital. And so that's how the profession is regulated. And like I said before, midwives are considered kind of experts in low risk, normal prenatal care and birth. And part of this training is kind of knowing when something is kind of veering outside of that normal range and knowing what to do in those situations. So whether it's prenatal care, there's some situations where we need to refer to an obstetrician or refer back to a family doctor if it's something that's outside of our scope of care. Same with if there's something that's happening during somebody's labor or during the birth where we need to refer. Sometimes we do need to transfer care to an obstetrician to deal with a more complicated situation that's outside of our scope of care. And same with most babies that are born are healthy and happy, but if anything is of concern, then we refer appropriately, either in the hospital to a pediatrician or if it's later postpartum, then back to the family doctor. So part of our training is to identify, what's kind of normal and what's to be expected, and when do we refer appropriately, and to refer people to the appropriate care providers. So yeah, I think that's slide.
Next slide.
Yep. Next slide. So yeah, a little bit about midwifery in Hamilton. So when you think about midwifery, there's, you think about delivering babies. So that's, obviously one of the kind of primary thing that midwives do. So in Hamilton, there's 4 midwifery practices. I think there's about like 30 or 40 midwives in Hamilton. It's pretty big now. Not everyone is working full time, but the number of midwives is quite large in Hamilton. So there's Community Midwives of Hamilton, which is located at right at Lock and Main Street. The Hamilton Midwives is on Charlton, across from St. Joe's. Mountain Midwifery Care is located just by Lime Ridge in the medical building by Lime Ridge Mall. And then Access Midwives is located in Stony Creek. So we're kind of spread out across the city. Some midwifery practices also do some satellite clinics. So for example, Community Midwives is where I work. There's 2 midwives at our practice who are French speaking, and so they do some satellite clinic at the French Community Center. We also do have some connections with Urban Core and the North Hamilton Community Health Center. So occasionally there's midwives who will do clinic there for clients of those community health centers, just to make our care a little bit more accessible for those clients. Same with Crown Point Midwives. So I work at Community Midwives, but I also am involved with the Crown Point midwives that work at the Crown Point Family Health Team. So we see some clients who are in that neighborhood as well for midwifery care. So I mentioned before that midwives in Hamilton work out of St. Joe's and McMaster. Another question we get is like, oh, like, do I have to have a natural birth? And there's, you know, aside from what the definition of natural birth is, a lot of people think that you can't have an epidural or any sort of medication or pain relief during labor if you had a midwife. And that is something that it does differ between communities. So how midwives are regulated, managing an epidural. So an anesthetist, a physician who's an anesthetist always puts in an epidural. But midwives it's within our scope of care to manage an epidural once it's in place. And also if someone needs an induction of labor, for example, if they go past their due date and they need an induction, that's also something that's within midwives' scope of care to be able to manage, as long as everything else in the pregnancy is straightforward and low risk. There are some communities in Ontario where midwives are required to transfer care to an obstetrician if somebody has an epidural in labor or requires an induction. And that's dependent on hospital policy and midwifery practice policy. But in Hamilton, all of the practices and at both hospitals, midwives are able to maintain care of their clients and aren't required to transfer care if clients request an epidural or if they need an induction, provided everything else is low risk. Sometimes people need an induction because something is going on and something else is high risk in their pregnancy. So that's a different story. But generally, we still maintain care for those things. So then a couple of interesting other things that midwives are doing in Hamilton. These are kind of interesting initiatives that where there's a role for midwives kind of outside of the like traditional delivering babies and prenatal and postpartum care. So the Shelter Health Network is a group of healthcare providers that works to provide healthcare, not just prenatal care, but healthcare to people who are accessing the shelter services in Hamilton. And part of this is who are involved in this, who are available to provide prenatal care to people who need it in the shelters. So this is like an on-call team that would be, you know, they would, if there was somebody who accessed the shelter and needed prenatal care, they could be called and they could go and provide care to that person, and then would help connect them with a more long-term maternity care provider in the city. So that's one thing that's been happening for a few years. That's a really great program to help reduce some barriers to accessing maternity care. And then there's a small group of us at Crown Point Midwives who are offering some expanded midwifery care. So what this means is offering services that aren't necessarily traditionally part of the midwife scope of care, but we've had extra training or worked with other physicians to get medical directives. So we're able to do some things, including IUD insertion, so intrauterine device for contraception, helping to counsel and manage early pregnancy loss, running sessions about menopause counseling, prenatal and postpartum peer support groups, which is sort of has been the program that I've been helping to get off the ground and have been running. We actually were running the postpartum peer support group out of the library, which is how we got connected to the library before we had to go out of the library. And then the other thing that another program is doing well baby community visits. If people don't have a family doctor or they aren't able to access a family doctor after they're discharged from the hospital. So the majority of midwifery care in Hamilton happens kind of within the kind of the model that you would expect, but there's also some other interesting things going on to kind of utilize the interests and skills and knowledge of midwives in a little bit of a different way. So that's pretty interesting. And then I think this is my last slide. So just where can I get more information? So I just thought these were some useful links about some of the information that I've talked about, or that if you're interested in looking into more information. So the links to the midwifery education programs at the 3 universities, McMaster, Ryerson, and Laurentian. links to the midwifery practices in Hamilton, as well as the Crown Point Midwife website, and links to our professional association, the Association of Ontario Midwives, and the College of Midwives of Ontario. And both of the association and the college have a lot of, like, they're both great websites, and they both have lots of information about, like, what is a midwife and how do I find one, and a lot of the common questions about midwifery care through those organizations. So, yeah. So that's
there
the,
it
like,
is. There it
quick
all is.
rundown.
That was good. It was very informative. I had prepared some frequently asked questions, and I'm like, oh, she's covering a lot of this. I'm just going to leave that up on the screen for a minute here before I stop sharing it. Now, you recommended that people seek out midwifery care as soon as possible if that is their chosen method. In your experience, does it fill up fairly quickly, or is it really just, is there a time of year where it's more popular?
It's hard. Well, I don't know if there's a time of year that's more popular. I feel like summer months tend to be busier, but I think part of that is midwives also take vacations sometimes. So sometimes we just have we have more people who are, like, just taking off August or whatever. So those months maybe seem to be busier just because there's fewer of us working, and there's still the same number of babies who want to be born.
Of course.
but most practices do have wait lists. So yeah, so I do, when I say, like, call as soon as you know, it's, like, sort of joking but sort of also serious. So
Understood.
Because it's not always the case, but I always recommend too, if you're, if someone's looking for a midwife and they call a practice and they're full, it's worthwhile calling other practices kind of within your, like, geographical radius as well, because someone else might have a space, and sometimes, driving another 10 minutes might be worth that care, even if it's not the place that's around the corner from you. So
for sure. I know
yeah.
40 seems like a lot, but 40 can get booked up pretty quickly, really.
Mm-hmm, mm-hmm.
Are midwives, can midwives give, I know they can manage medications. Can they give medication? What kind of tests can they order?
So in
order?
pregnancy, we can order all the same, like, lab tests, screening tests, ultrasounds that somebody would normally get in pregnancy. So all the standard blood work, genetic screening, ultrasounds, we would be able to order those tests, and generally the follow-up tests as well. If there's something that comes back that's again outside of our scope, then we would refer appropriately. We work with the clinic, the prenatal diagnostic clinic, and the maternal fetal medicine clinic through McMaster. If someone has something going on that's more complicated, or obviously just an obstetrician in the community as well. So yeah, but the standard lab tests, ultrasound, screening tests that you would normally get in pregnancy, we order that. Yeah.
Okay.
Yeah.
Okay. And it's 6 weeks postnatal care or postpartum care. Yeah. Okay. And at that point, I'm assuming people are going to their doctor as well to get the shots and everything, and they're just kind of
So yeah. So the vaccinations for babies starts at 8 weeks. So usually people see us until 6 weeks.
See?
And then they go to their doctor at 8 weeks. Yeah. No,
okay.
No, that's fine. So yeah. So usually people don't need to see. Yeah. So usually if you see a midwife, you don't need to see a doctor. Obviously, like I say, like, well, yeah, sometimes people call and they'll be like, well, do I need to see my doctor first before I come see you? And more with friends, I'm like, well, like, you can if you want, but, like, we're also going to do all the tests and stuff anyway, so you don't have to. And same during your pregnancy, you don't need to see a family doctor or an obstetrician, because we do the same thing. We're considered primary care providers, so we're providing all the same care that you would get. And same with the baby until 6 weeks, unless there's something going on where it'd be like, oh, this isn't really something that I can deal with, you should go see your family doctor. In that case, we'd refer back to the family physician. So
it's not necessarily
but if
within your scope. Yeah.
Yeah. But usually if everything's kind of carrying on normally, then you wouldn't necessarily need to see a doctor for your pregnancy or postpartum.
Okay.
Yeah. Mm-hmm.
We are getting somebody new here. There we go. Okay. Thank you very much. Let me see. So let me see. Do midwives, I was surprised by the 80% and 20%. 80%
Mhm.
giving birth in hospital and 20% in home births, because I always associate it
Mhm.
with a home birth. Um,
Yeah.
do,
Yeah.
do midwives generally recommend home births, or no recommendations whatsoever? What?
I think it really comes down to the preference of the client.
Okay.
I think in different communities you have different rates of home births. So in Hamilton, it's actually probably lower than 20% overall.
Okay.
But there's other communities where there's a higher home birth rate. Um, I think some practices where midwives need to transfer care if someone has an epidural, or transfer care if they have an oxytocin. Those communities have a higher home birth rate, or some places where they have a high population of like Amish or Mennonite clients.
Okay.
They have high home birth rates as well.
Sure.
Like Stratford outside London, those some practices in those geographical areas tend to have a bit higher home birth rates. Or there's also some practices in Toronto where there's just such a high population density that all the people who want home births go to midwives, and so they can kind of select their clients just because they have such a much a higher population. So
Yeah.
so it depends across the province, but yeah, about 80% hospital births. Mm-hmm.
Okay. Okay. Again, for those of you who are joining us, if you have any questions, please feel free to place them in the chat. We are doing a frequently asked questions portion right now. We are recording right now, but at the end of the recording, we will turn on our cameras and allow everybody to just have a round table. Right now, we are recording. Next question. What is the difference between a midwife and a doula? And would you recommend a doula?
So this is a very common question. So doulas provide like physical and emotional support during labor. Doulas are very helpful for some people during, like, for labor support, for prenatal support, and for postpartum care. Um, and so we do work we work with clients who do hire a doula. Doulas are not covered by the healthcare system, so you do have to pay
Right.
privately for a doula. So that's one difference. But for some people who feel like they want a little bit more support during labor, then it's definitely a great option. Midwives do also obviously provide physical and emotional support during labor. We're also doing all of the like medical monitoring of mom and baby during labor as well. So sometimes, if having an extra person there who's just there to focus on supporting the person who's in labor can be really helpful. And so it's that's a decision that kind of families can make for themselves. And some people are like, yes, I feel like my partner is not going to be helpful, so I want someone else to know what's going on, who can actually like support me and isn't going to freak out or isn't going to be like weirded out by what's going on. So sometimes in that situation, it can be helpful to kind of have that extra person that you've discussed your expectations about birth with, and who is there to just really focus on supporting during labor. So that's it is a role that we take on in labor as well, but we're also kind of also doing the medical monitoring of mom and baby during labor. So there's times when we can be very hands-on, and sometimes when we're like, we'll actually have to do this other stuff right now too. So
Yes, you've got
yeah.
divided attentions there. True
Mhm.
story. My husband actually got in trouble by the nurse because he was making too many jokes during my delivery.
There's
She
a
was
time where
like,
it's
"Your
like,
life is
now is
in
not
pain."
joking
Yeah,
time.
exactly.
Yeah.
You would
It's
not be
like,
joking
we've
if you
like crossed the line where it's like, no, sorry, not joking time.
exactly. So here's a personal one. What made you decide to become a midwife?
That is a good question. So I was interested in healthcare. So it's interesting because if you talk to any midwife, there's like a whole range of like stories of how people came to midwifery care. Some people like saw their sister born and that's what inspired them, and other people, they've wanted to be a midwife for a really long time. I was always interested in healthcare and women's health and social justice and that sort of thing in university. And so when I was graduating, I wasn't really sure what I wanted to do, but I was looking into healthcare, like healthcare programs, med school, nursing, and came across midwifery, and it seemed like a really good fit. And the more people I talked to, I was like, oh, this person that I've known for many years had a midwife with their kids, and the prof that I was working for had midwives with his kids, and so it just seemed like it was a good fit, and it turned out that it was. So it kind of, for me, it was more like, okay, I'm interested in healthcare. What different roles in healthcare are there, and what seems like a good fit for what I'm looking for? So, so that's sort of how I came to midwifery. Mm-hmm.
And in following that, what was your first delivery like?
So my first delivery, like, that I ever saw, or that I was actually a midwife for?
Either one or both.
One. I feel like both were scary, actually.
Yeah, I believe it.
I feel like as a student, we do like a placement on labor and delivery, and I feel like the first one, it was like very intense, and I was like, oh my gosh, this is like, that is not what I was expecting. And then so that was as a student, but I was like, okay, but I can handle this. And then I think replacement as a student, I had a couple of really lovely home births that were very calm, and I was like, oh, okay, yes, this is different than that experience over there. And then as a midwife, I think it felt really chaotic, just because I was like, when you start at a new practice, you usually have another midwife who's mentoring you to help you with like all of your hospital logins and where to go and where stuff is kept. And it was a birth that happened very quickly. So it was sort of like, I just felt like very discombobulated, because I was like, where's all this stuff? And it was sort of a situation where it was like, if the baby's going to come quickly, it's going to come quickly, and I don't really have much to do with it. So,
That's pretty funny. You had all these expectations, and then it was like, whoops. Yeah.
You just can't. You can only plan so much, and you think you know how things are going to go, and then it doesn't go that way. So, yeah.
For sure. Let me see. Here's one. How difficult is your lifestyle being on call? Do you have a story about the most inconvenient time you were called away to a birth?
Oh, it definitely is a lifestyle that takes getting used to. And I often tell midwifery students that part of being a student is getting used to being on call. It's like, part of it is being like actually learning the clinical skills that you need to know as a midwife, but part of it is just getting used to being on call, because it's just a different mindset, and you're kind of like your baseline level of like stress and like knowing what's going on is just like up here instead of down here if you're on call, because in the background there's always something that could potentially happen. So I'm trying to think. I don't know what the most inconvenient time was. We usually have, like, as a family, especially if we're like going somewhere, we usually have an exit. Like, I usually have a bit of an exit strategy. Like, we take 2 cars if we're going somewhere that's a little farther, or it's like, okay, you're going to need to like circle back and drop me off at the hospital if I need to go somewhere. So it's more like those kind of logistics are just a little bit, add an extra layer of planning into things. So, but this past Thanksgiving weekend, I was called to a birth when everyone was having Thanksgiving at my house.
Yes, I was wondering. Yeah,
but it happens, right? So,
did it ever happen at Christmas? That's the big one.
I think not at Christmas. But New Year's. The first year I was working, I was definitely like away. I got called at like 9 o'clock on New Year's and was away all night. So I was like, okay, bye, friends, we're at our house. But but that's okay. Comes with the territory.
Yeah, yeah, it's exciting. So I guess you're going from one exciting thing to another there. And then let me see. I guess last question, what is the main difference, in your opinion, between having a midwife than having a doctor? I know you mentioned that continuity of care.
Yeah, continuity of care, I think, is one thing that's different. One thing that's really like that's like kind of a tangible difference is our appointments tend to be a little bit longer. So we usually book about half an hour to meet with our clients for their prenatal visits. So just having that time, there's usually in an appointment, we do our normal like blood pressure check and listen to the baby's heartbeat. And there's usually some discussion topics that we have to talk about. But there's usually a good amount of time for our clients to ask us questions if there's stuff that they're thinking about or about stuff that's coming up. So I think that's something that people appreciate, is just having that extra, like that a little bit of extra time to kind of get to know the person and talk about what's on their mind. So I think that's one thing that's a little bit different. Because our philosophy is really like wanting to have people as an active participant in their care, and really be informed about like the decisions that are happening throughout their pregnancy. Sometimes I say like, it would be I would never say to someone like, here, go for this blood work, and not explain what it was for, or what we were looking for, what your previous blood work said this, and this is why we're checking it. And I think that's probably important in every aspect of healthcare, but especially in pregnancy, I think it's important that people are really informed and know why we're recommending something, why they might want to go for some certain screening test, what the risks are, and things like that. So
for sure, is it about the same amount of appointments between being a midwife or having a midwife? Same schedule.
We follow the same schedule of visits. Yeah.
Okay.
Yeah.
It's perhaps a little longer. Thank you very much, Christine Sandor. It has been a pleasure. Thank you for all the very valuable information.
Thank you. This is great.